The survey design was different, slightly different from the earlier sero surveys in the sense that we have included children in this sero survey from 6 to 17 years of age, as well as adults, the general population, which is 28,975 individuals. We also studied the healthcare workers, which were 7,252 individuals. And this was done in the same 70 district as the first survey, second survey, and the third survey in 21 states. 10 villages per ward from each district, 40 individuals per village per ward, and 40 individuals aged more than 6 years per district, 400 individuals more than 6 years per district, and 100 healthcare workers per 100 healthcare workers. Is that better? Okay, okay. Is that better? Yeah, so 100 healthcare workers per district from district and sub-district hospitals. Now, we enrolled 28. Now, let's concentrate on the general population, which includes 6 years and above an adult population. So, 6 to 9 years, we had 2,892 individuals, and more than 18 years, we had 20,282. Now, here, interestingly, you have to remember amongst the adult population, that is more than 18, there was no vaccine in 12,607. That is 62.2% did not have any vaccination. 24.8% of the people surveyed in the adult population had 1 dose of the vaccination, and 13% of the individuals had both doses of the vaccine. Now here we have this number, that is the overall seroprevalence is 67.6% in the entire population, which is from 6 years and adults included. Now if you disaggregate this data of seroprevalence, between 6 to 9 years it was 57.2, 10 to 17 years it was 61.6%, 18 to 44 years it was 66.7%, now 45 to 60 it was higher, 77.6%, and more than 60 years around 77% again. So more than 45 years it's around 77%, and rest it is about 67% as a major. Male, female, no difference. Rural, urban, there was no difference at 66 and 69, slightly higher in the urban areas. Now this is the trend of seroprevalence over time. That is the first one, which was done in May, June of 2020, where it was 0.7%. Then August, September of 2020 to 7.1%. December, January 2021, it was 24.1%. And today, as we speak, that is June, July, it is 67.6%. Now the Sero survey as per vaccination status. So in unvaccinated, the prevalence was 62.3%, and with 1 dose of vaccine, it was 81%. And if they had received both the doses, it was 89.8%. Now that is about the general population and children and adults. Total 67.6%, and highest in the people who were above 45. Now, if you look at the healthcare workers, so we studied 7,252 healthcare workers, and 10% had not taken the vaccine, 90% had taken the vaccine, and the overall seroprevalence in the healthcare workers was 85.2%. So, in conclusion, 2/3 of the general population, that is above the age of 6 years, had SARS-CoV-2 infection. More importantly, 1/3 of the population did not have any antibodies. That is still approximately 40 crore population of this country is still vulnerable. States and districts and areas without antibodies run the risk of infection waves. More than half of the children 6 to 17 years were seropositive, and seroprevalence was similar in rural and urban areas, and 85% of the healthcare workers had antibodies against SARS-CoV-2, and 1/10 of the healthcare workers were unvaccinated, that is around 10%. So what are the implications of this sero survey? So the implications of this large sero-survey done as round number 4 clearly show that there is a ray of hope. But there is no room for complacency. We must maintain COVID-appropriate behavior and community engagement. An important point to remember here is the National Sero-Survey is not a substitute for local, that is state or district level survey. It is not a substitute. It is just giving a bird's eye view, the overall picture, panoramic picture of what is happening in the nation. But there is heterogeneity which is occurring from state to state, district to district, and we should be cognizant of that. So state-led sentinel sero-surveillance will inform further state-level action. State heterogeneity indicates possibility of future waves of infection. There may be some states which are very low and the population which is vulnerable is much higher there, and therefore the chances of future waves are higher in those states. Societal, public, religious, and political congregations be avoided. Non-essential travel be discouraged. And travel only if fully vaccinated. So these are some of the messages in terms of the implications. And the way forward is that we need to ensure full vaccination of all healthcare workers as soon as possible. We need to accelerate vaccination coverage in vulnerable population groups. We need to ensure adherence to the non-pharmaceutical interventions. Continue tracking COVID infections in SARI cases in district hospitals. So that is another very important tool that we use the SARI patients and test them for COVID and rule out if there is any sudden spike of COVID happening in these SARI patients, as we started in March, April last year when we were doing survey for the beginning of the first wave. We need to identify clusters. If there is a sudden appearance of number of cases in a certain area, we need to look at certain clinical severity, and the INSACOG is tracking the variants of concern. So I will stop here and be happy to answer any question, but more important to remember that there is a ray of hope and there is no room of complacency. We are 2/3 of the way of the population is affected, is positive, seropositive, and 1/3, which is a large population for seeing the size of our country, is still vulnerable and still susceptible. But as the virus needs a susceptible host, so that susceptible host is available in 40 crores in this population. States would vary from state to state, and many states have done their own sero-survey. Some of them are doing it at the district level, and that will that'll be very helpful in further guiding the response to the pandemic. However, the major response of societal, public, religious, and political congregations not happening still remains absolutely important. Non-essential travel to be avoided, and travel only if vaccinated, and community behavior, COVID-appropriate behavior and community engagement are absolutely essential for fight against COVID-19. Thank you so much for your attention.